my second video. I'm so excited to be back again, to be connecting with you. So in my first video, my very first video, you welcomed it with great love, and I'm so thankful, I'm so grateful. I would like to thank you and appreciate every one of you who watched, who subscribed, who commented, who liked. Thank you so much for your great support. Stop. Thank you so much, everyone. I'm so grateful. So today I would like to take you through my journey as a diabetic, how I was diagnosed, how I knew I was diabetic, and when was that. So it was in 2022, around September the 25th. That time I was breastfeeding my last daughter. She was around a year or so. Around a year. She was not a year, maybe some months, I'm sure about that. So I went to work. It was just a normal day for me. It was a Monday. I work at a hospital. I'm a healthcare provider. So I went to work. It was just a normal day. I went to work. When I went to okay, so it was just a normal day. I went to work. On a Monday, I was feeling dizzy. I didn't know, my head was just lightheaded. I didn't know what was going through me. So I went to work. I started my day, and around 9, I started feeling dizzy. I started feeling hot flashes. It was something else. And then I went to a colleague and I said, can you please check my blood sugars in the ward? And she checked me. She was so shocked, and she said, are you diabetic? And I said, no, I'm not. Why did you say so? And she said, your sugars are very high. They were around 32 or so. And I was so shocked because the normal blood sugar should be between 4 to 7 for a normal non-diabetic person. So I was not a pre-diabetic, I was a diabetic person, but I didn't know. So I was so surprised, and she said, you have to go to the staff clinic like right now. And prior to that, about a month or two before, I started my weight loss journey, and it was going on so well. Within 2 months, I lost 15 kgs, but it was not normal because the rate at which the weight was lost wasn't normal. My husband kept saying, this is not normal, you shouldn't lose this, the rate is just too much. And I was so happy. I just said, no, I'm losing weight, I know it's Linda. I was so happy, I was so excited. I didn't know that I was diabetic. Wow, you guys. I went to the staff clinic, the doctors checked me and they said, we need to go to see some physicians. And then I went to see physicians and they checked me again. Instead of checking me further, they put me into resuscitation because it was so high. It kept skyrocketing, even up to 38. And people were so surprised. If you are someone who is diabetic and you have 38 millimeters, that rate at which the DM is up, you should be in coma. Oh, yes. So at that rate, people were so surprised. Doctors came looking for me, and they were so surprised, saying we've got a staff member in here who's not well, whose DM readings are too high. And everyone was so sad. Like, most people were sympathizing with me. And if you are around that 30 or so, even up to 40 or whatever, you should be in coma under normal circumstances. Either you are in coma or you are mentally unwell. That's how diabetic works. Like the diabetes work. That's how diabetes works. So I was confused. I was trying to figure out when I became diabetic, and that time I was around let's say I was 35 years. Most diabetics who are type 1 diabetics, you should be losing your mind. So I was stable, but I just wasn't myself. The doctors gave me some IV fluids. Like, I went under treatment. I was given insulin. I was given a whole lot of medication. So after about an hour or so, the blood sugar started to normalize a bit, maybe from 32 to 30 to 28. Yeah. So remember, this was just a normal day. I'd gone to work and said my goodbyes to my family, bye my children, bye my husband, bye everyone. I'm coming back in the evening after work. And here I was in the resuscitation. I didn't know this was gonna happen to me. So after all the assessments were done, I was told that I was going to be admitted. Remember, I was wearing my work uniform. Remember the stress that I went through. Just imagine, I was under a lot of stress. And those beds that we used to see most patients sleeping on and going to the ward, I was the one on that bed, and I was the one going to the ward. Oh, and oh my colleagues, oh my